Welcome back to the Lost Book of Herbal Remedies. I'm Emma, and today we're tackling rheumatoid arthritis, a chronic autoimmune disorder that affects around 1% of the global population. And here's something that may surprise you. Rheumatoid arthritis has a 60% inheritance rate, meaning genetics play a huge role in determining who's at risk.
That's right, Emma. Rheumatoid arthritis isn't just a joint disease. It's a systemic condition that affects much more than we think, including the lungs and even the wrists, leading to complications like carpal tunnel syndrome. Today, we'll break down the genetic factors, immune system involvement, and emerging therapies, including some powerful herbal remedies.
Exactly. Let's start with the genetics, because that's where a lot of the risk comes from. Studies show that certain genes, especially HLA alleles, like HLA-DRB1 TAR01 and HLA-DRB104, are strongly linked to developing rheumatoid arthritis. These alleles contribute to the 60% heritability rate.
And beyond that, more than 150 genetic markers, known as single nucleotide polymorphisms, SNPs, have been identified. These interact with environmental factors like smoking or infections to kickstart the autoimmune response that leads to the persistent joint inflammation in rheumatoid arthritis.
Right. When the immune system gets triggered, it starts attacking the synovial tissue in the joints, leading to that inflammation and pain we associate with rheumatoid arthritis. But it's not just the joints that suffer. The immune system also goes into overdrive with B cells producing autoantibodies, rheumatoid factors, and anti-citrullinated protein antibodies that contribute to this destruction.
And then we have the role of T cells. CD4 plus T helper cells activate macrophages and synovial fibroblasts, which cause even more damage by breaking down cartilage and bone. This is why it's so important to target the immune system in treating rheumatoid arthritis.
And one promising target is RBPJ, a transcriptional regulator that helps maintain immune balance. Studies have found that RBPJ levels are significantly lower in people with rheumatoid arthritis, and this correlates with higher disease activity. Restoring those levels could help control the immune response and reduce inflammation.
That's exciting, and it shows how much potential there is for targeted therapies. But let's not forget about complications. Carpal tunnel syndrome is one of the most common extra-articular issues. The inflammation in the wrist can compress the median nerve, causing pain and numbness.
Exactly. And rheumatoid arthritis also affects the lungs. Studies show that 61% of rheumatoid arthritis patients have some form of airway abnormalities, including bronchial wall thickening and airflow obstruction.
And it's not just about diagnosing early. There's also a risk of overdiagnosis. Screening for complications like interstitial lung disease in rheumatoid arthritis patients can sometimes lead to unnecessary treatments, adding to the financial and emotional burden of the disease.
That's a good point, Alex. Now, let's dive into some herbal interventions which are gaining attention as complementary treatments for rheumatoid arthritis. One of the most well-researched herbs is turmeric. The active compound, curcumin, has potent anti-inflammatory properties.
And turmeric is just the beginning. Ginger, with its gingerols and shogals, has been shown to reduce inflammation and joint pain. Studies suggest it works by inhibiting the production of pro-inflammatory cytokines.
And there's also Boswellia serrata, or frankincense. Boswellic acids help reduce inflammation by inhibiting leukotriene synthesis, a key player in the inflammatory process.
Exactly. Then we have green tea, which is rich in polyphenols, especially EGCG. These antioxidants reduce oxidative stress, a major factor in the progression of rheumatoid arthritis.
And don't forget ashwagandha, an adaptogenic herb that helps reduce stress and modulate the immune system. Its immunomodulatory properties are especially useful in autoimmune diseases like rheumatoid arthritis.
There's also omega-3 fatty acids, which aren't an herb but play a crucial role in reducing systemic inflammation. Combining omega-3s with herbal remedies can offer a more comprehensive approach to managing rheumatoid arthritis.
Another herb worth mentioning is thunder god vine. It's powerful and must be used cautiously, but it has shown potential in suppressing autoimmunity and modulating the immune response.
And then there's black cherry, which is rich in anthocyanins. This helps reduce uric acid levels and inflammation, providing relief from joint pain.
All of these herbs form the basis of our formula in the Lost Book of Herbal Remedies. This blend, including turmeric, Boswellia serrata, ginger, green tea, ashwagandha, and omega-3 fatty acids, works together to reduce inflammation, modulate the immune system, and alleviate joint pain.
But remember, always consult a healthcare provider before starting any new herbal regimen, especially if you have pre-existing conditions or are on medications.
Right. Managing rheumatoid arthritis isn't just about treating the symptoms. It's about addressing the underlying mechanisms, from immune dysregulation to genetic factors.
If you want to learn more about these herbal remedies and how they can support your treatment, visit herbalbloom.org.
Thanks for joining us for this deep dive into rheumatoid arthritis. Be sure to share this episode with anyone who might benefit from this information, and stay tuned for more natural remedies and holistic health insights.
See you next time.